بسم الله الحمد لله والصلاة والسلام على رسول الله صلى الله عليه وآله وصحبه وسلم. This is our second lecture in the pharmacy practice course. In this lecture we will start talking about responding to symptoms, and first we'll talk about the respiratory system. In this lecture we will talk in respiratory about the common colds and flu. Inshallah ta'ala, in this lecture we will differentiate between the symptoms of common colds and flu. As we know, both of them are viral infections, and inshallah we will know how you as a community pharmacist will respond well to these symptoms. By the end of the lecture, inshallah, we will discuss a case regarding these symptoms, common colds and flu. Every working day, people come to the community pharmacy for advice about minor elements, and this is we discuss the effect and the substantial effect of the OTC medicines in treating these minor elements in the previous lecture. The pharmacist's role in responding to symptoms and overseeing the sale of OTC medicines is substantial and requires a mix of knowledge and skills in the area of disease and their treatment, and we discussed this also in the previous lecture. The pharmacists are responsible for ensuring that their staff provide appropriate advice and recommendation for the patients or for the customers. Especially the senior pharmacists should supervise junior ones, and should supervise also the pharmacy technicians and ensure this appropriate advice and recommendations that should be given for the customers or for the patients. Now we talk about common colds and flu. The common cold and flu are both respiratory illnesses, but they are caused by different viruses, so that there is a differences in the symptoms and the severity. Almost the symptoms are the same, but there is a differences in this severity of these symptoms. Colds are usually milder than flu. Although colds are self-limiting, many people choose to buy OTC medicine for symptomatic relief of these symptoms. نحن كسوداني عندنا مقولة بيقول لك إنه الكومن كولد أو النزلة إذا عالجت لها هتاخد أسبوع، وإذا ما أخذت لها علاج هتاخد 7 أيام. Is there any differences? No, but actually the use of this OTC medication will reduce the severity of the symptoms of the common cold. People with colds are more likely to have a runny or stuffy nose. This is in comparison between common cold and flu. We will find that the stuffy nose or nasal stuffiness usually occur with colds rather than flu. Also, colds generally don't result in a serious illness problems such as pneumonia, bacterial infections, or hospitalization. But symptoms are more common to be found with flu rather than colds. In this table, there are differences between the common colds and flu. The first difference is the symptoms onset. The onset of the symptoms we'll find it gradual in case of common cold, while occur abruptly in flu. The fever usually are rare in occurrence in case of cold, while it's usual occurrence in case of flu. Aches such as the muscle ache usually occur with flu, while there is slight muscle aches with cold. Chills uncommon with cold but fairly common with flu. Fatigue and weakness sometimes occur with cold but usually occur in case of flu. Sneezing common with flu while occur sometimes with common with cold while occur sometimes with flu. Chest discomfort and cough usually occur mild to moderate in case of cold, and this is common symptoms that associated with flu. Stuffy nose or blocked nose occur commonly with cold while sometimes occur with flu. Sore throat, this is very common with cold, and usually this is the beginning or the start symptom or the symptoms that indicate there is the patient will suffer from cold. The sore throat usually occur with cold and sometimes occur in case of flu. The headache is rare with cold and very common or common with flu. As a pharmacist, what you need to know regarding these symptoms or respiratory symptoms are these this is the list of what you should know if the patient or customer come to you in suffering or talking about these symptoms. The first, you should know the age of the patient. Is it a child or adult? Because the age will directly influence the choice of the medications. Besides that, the age also is a side or for a decision whether you will refer the patient or not in case of younger patient, child less than 2 years, you should refer, and in case of also geriatric patient that over 65 years old, you may also need to refer the patient. And duration of the symptoms is very important. We will discuss in the coming slides. We will discuss all of these duration of the symptoms. Is there any runny blocked nose? Also, because this is can differentiate between cold and flu. Is it a summer cold? Because sometimes the occurrence of the cold in the summer may be confused with allergic rhinitis, which are more common in the summer season. If there any sneezing or coughing, generalized aches, headaches, their higher temperature, sore throat, earache, facial pain, frontal headache, flu, asthma. If the patient suffer from this regarding a previous medical history of the patient, asthma or allergic rhinitis or bronchitis, heart disease, because all of this can influence your decision. Is it to refer the patient or to give him a suitable OTC medication? Also the present medication, because the present medication can be or should be taken in consideration in case of there is a drug interaction or so on. We'll discuss these issues. First, the age, establishing who the patient is, child or adult, as I mentioned, will influence the pharmacist's decision about the necessity of referral or to the doctor and the choice of treatment. Also in diagnosis, children, this can help you to differentiate because children are more susceptible to the upper respiratory tract infections than adults. The duration of the symptoms, patient may describe a rapid onset of the symptoms or gradual onset over several hours. The former يعني البداية الرابid onset أو abrupt onset of the symptoms is said to be more commonly true of flu, as I mentioned in that previous comparison. The rapid onset indicate that the patient suffered from flu, while the later اللي هو gradual onset of the symptoms اللي هو usually indicate the patient suffer from common cold. Such guidelines are general rather than definitive. لكن هذه الجايدلاينز هي في الغالب الأعم، لكن ما هي يعني قاطعة في إنها تحدد الرابيد اونست خلاص هو طوالي، هو فلو، والجراديوال هو كولد. ده أحيانا قد يحصل العكس، لكن mainly generally this is اللي هي guidelines أو indicate في الغالب إنه الرابيد onset والabrupt onset هو indicate الفلو rather than the common cold. The symptoms of common cold usually last for 7 to 14 days. Some symptoms such as cough may persist after the worst of the cold is over. في الغالب انه هو المتوسط بتاعه تقريبا about 10 days، لكن قد تاخذ لحد 14 يوم، وقد تستمر الكف البيرسيستنت كف قد تستمر بعد ما البيشنت يبقى هو يعني free from the other symptoms، لكن ال persistent cough may persist for a longer time. The blood nose or runny nose, most of the patient will experience a runny nose, rhinorrhea, excessive nasal due to the excessive nasal secretion. Nasal congestion also occur because of the dilatation of the blood vessels, leading to the swelling of the lining surfaces of the nose. This narrows the nasal passages, which are further blocked by the increase of the mucus secretion. The nasal congestion is best treated by sympathomimetic drugs, because the sympathomimetic drugs act on alpha-1 receptors في blood vessels that lead to vasoconstriction, so that decrease dilatation, and so that reduce the swelling of the lining surfaces of the nose and improve the narrow that occur in the nasal passages, which lead to the blocked nose. The sneezing and coughing occurs because the nasal passages are irritated and congested. A cough may present either because the pharynx is irritated, producing a dry cough, or due to as a result of irritation of the bronchus caused by post-nasal dripping. والبوست نازل دريبنج اللي هو نتيجة للإكسسيف secretions في النازل excessive secretion of the nasal secretion which fall down through the nasal cavity to the pharynx. This can irritate and can result in اللي هو result in the cough. Aches and pains including the headache are common with both common cold and flu, but the severity as we mentioned occur mainly in case of flu. Headaches may be experienced because of inflammation and congestion of the nasal passages and sinuses. Persistent or worsening of the frontal headache or pain that occur above or below the eyes may be due to the sinusitis اللي هو الالتهاب بتاع الجيوب الأنفية. People with flu often report muscular and joints aches, and this is more likely to occur with flu than with the common cold as we mentioned. The high temperature, those suffering from a cold often complain of feeling hot, but in general a high temperature will not be present. This is in case of cold, while the presence of fever may be an indication that the patient has flu rather than a cold. والآن انتم عارفين يمكن الفيرست سكرينينج للبيشنت ذات كوتنج ذيس كورونا فيروس اللي هو الديتكشن بتاع الهاير تمبريتشر اللي هي لأنها viral infection and also that responsible for respiratory symptoms. The sore throat often or the throat often feels dry and sore during a cold and may sometimes be the first sign that a cold is about to occur. We mentioned that this sore throat, the first sign that indicating a cold is about to happen or about to occur in the patient. The earache is a common complication of colds, especially in children. This is due to the blockage of the Eustachian tube, and this is the Eustachian tube. Eustachian tube is a tube that connecting between the middle ear and the back of the nasal cavity, and this is a Eustachian tube. Due to the blockage of this Eustachian tube, the earache will occur due to this blockage. This situation often resolves spontaneously. No need to have a medication regarding this symptom, earache. But congestion can be helpful. If it is troublesome to the patient, the congestion can be resolve this earache. Sometimes the situation of earache worsens when the middle ear fills up with fluid. This so that the air becomes acutely painful and can require antibiotics, and this is typically will result in the acute otitis media. There is an evidence that both paracetamol and ibuprofen, both of them are OTC analgesic drugs, are effective in treatment of acute otitis media. However, if the pain were to persist or to be associated with unwell child, especially if there is a high temperature or you see the child very restless, worried child, or if there is an vomiting combined with a vomiting, so that as a pharmacist you should hear this is a site for referral. You should refer the patient or the child to a GP, general practitioner, who should be referred to for more advice or for more investigation or for indication maybe of antibiotic, and this is not your responsibility to give an antibiotic. Antibiotics are not an OTC medicines. The facial pain or frontal headache may signify اللي هو sinusitis، التهاب بتاع الجيوب الأنفية. In a cold there is the lining surface will become inflamed and swollen, producing excessive discharge, and this discharge results in secretions that drain into the nasal cavity. If the drainage passage becomes blocked, then the fluids will build up in the sinus, and the sinus will be congested with these fluids and become a source for secondary bacterial infection. The headache typically worsened by the lying down or bending forwards. الناس المرضى اللي عندهم اللي suffering from these symptoms, they will find that if they're lying down or bending forward, because the fluids will congested more, this will worsen the pain of this facial or frontal headache. As I mentioned in the first slides, you should ask the patient if he is asthmatic, because asthmatic attacks can be triggered by respiratory viral infection. So if you find that the patient is asthmatic and he came to you in the community pharmacy asking about OTC medication for their common cold, you should refer this patient, because the viral infection may result in an asthmatic attack. So he need an advice from his GP doctors. People with a history of chronic bronchitis may be advised to see their doctor. برضو المرضى اللي بيعانوا من chronic bronchitis برضو لأن الفيرال infection can worsen bronchitis, so that the referral is advisable. if they have a bad cold or flu-like infection, as it often causes an exacerbation of their bronchitis. The pharmacist must ascertain any medicines being taken by the patient, and it is important to remember that interaction might occur with some of the constituents of commonly used OTC medicines. We talk about this in the first lecture. And also in the coming slides we'll discuss these possible or interactions that may happen or may occur due to the common colds OTC medicines. When to refer, and this is a summary for the situation in which you need as a community pharmacist to refer the patient if he came to you or a customer come to you asking about OTC medicine or medication for a common cold or flu. The first, if there is an headache not settling with analgesic. Not settling with analgesic. If the patient came to you for the first time and he mentioned that he suffered from headache, and you give him paracetamol or ibuprofen for this headache, and you give him a time scale for 10 days to come back for a feedback. Then when he came back, when he came back to you, he still mentioned that he is still suffering from headache. So it is here this patient is needed to be referred, because maybe he suffered from an acute otitis media or whatever. You should refer this patient. The second situation, if the patient have a facial pain or frontal headache, and because this can indicate sinusitis, the patient should be also referred. In case of very young patients, who are child less than 2 years, it is recommended to refer these patients. And also in case of geriatric patient older than 65 years old, it is better to refer these patients. In those with heart or lung disease, such as chronic bronchitis or asthma, it is better to refer these patients. Patients with persisting fever and productive cough, also it is better to be referred, because they may suffer from secondary bacterial infection that occur due to the first viral infection. If the patient with delirium have a symptoms of delirium hazayan, it is better to refer this patient. And also if the patient suffer from pleuritic chest pain, pleuritic, if the patient have a inflamed pleura اللي هي على الجانب بتاع lungs, if he suffer from this pleuritic chest pain, it is better to refer this patient for more investigation. Generally, regarding the OTC medication that given by the pharmacist, for each of these OTC medication, you should have a time scale, time limited. Once the pharmacist has recommended treatment, any treatment regarding OTC medication for common cold or fever or cough or whatever minor elements, the patient should be advised to see their doctor in definite time. Here, in case of colds and flu, 10 to 14 days. If the colds or the symptoms has not improved, if not improved within 14 days after starting the medication, OTC medication, they should see, you should ask them directly to be referred out to see their physicians regarding these unimproved symptoms. And now we'll talk about the management of the common cold and flu. And the first choice, we have decongestants. Decongestants, as we know in the pharmacology, they are sympathomimetic drugs, either given orally or topically through the nasal spray or nasal drop. The oral symptomatic drugs usually used اللي هو either pseudoephedrine هو available orally, pseudoephedrine and الفينايل بروبانوlamine. Both of these are available orally. Can be effective in the reducing the nasal congestion orally or applied topically. The topical decongestant commonly used are xylometazoline, nafazoline, oxymetazoline, vinyl heparin, ephedrine. All of these are used topically. And the pharmacology of these drugs are sympathogenic drugs that directly stimulate the alpha-1 receptor, alpha-1 adrenergic receptors, leading to vasoconstrictions of the blood vessels, so that lead to the decrease swelling and the congestion that occur due to the swelling of the blood vessels, and decrease the secretions, and so that they can relieve the congestion. The pharmacist should advise the patient not to use the product for longer than 7 days. These congestions should not be used more than 7 days. The pharmacist can give useful advice about the correct way to administer nasal drops and spray. يمكن there is no problem في nasal drops، لكن الspray need a technique. And inshallah by the end of this lecture we will provide you with a video that indicate the proper use of nasal sprays. This is commonly used, the nasal decongestant. We find Flotab. In this preparation we will find an decongestant, nasal decongestant اللي هي in Flotab. We have a pseudoephedrine, analgesic drug. We will find paracetamol, and antihistamine. We'll find triprolidine. Prolidine as antihistamine. This for symptomatic relief of cough, for cold and flu. This is a NoFlo. NoFlo اللي هو كان فيه paracetamol and vinyl propanolamine and chlorpheniramine malate. This is a 3 اللي هو analgesic with sympathomimetic agent with antihistaminic drug. But this product now is withdrawn from the market because it contains phenyl propanolamine, and phenyl propanolamine, according to the US studies, indicates that it's responsible for some of the cerebral events that lead to cerebral hemorrhage نتيجة للفازوكونستريكشن اللي بيعمل في المايكرو cerebral blood vessels, lead to the rupture of these blood vessels and leading to cerebral hemorrhage. Now withdrawn from the market due to this ingredient. We'll find also, as they are available as tablets, they also available as in syrup اللي هو for blocked and runny nose. This is activate فيه triprolidine مع اللي هو مع pseudoephedrine. الاوتوليفين اللي هو فيه xylometazoline selective alpha-1 agonist in the case of in dosage form of eye drops and dosage form of nasal spray. The pharmacist should be aware that some of these drugs, ephedrine or pseudoephedrine, when taken orally, have the potential to keep the patient awoke because of their stimulating effects on the central nervous system, so that it is reasonable to suggest that the patient avoids taking a dose of the medicine near the bedtime. Because these are CNS stimulants, the pseudoephedrine, ephedrine, even vinyl propanolamine, they are CNS stimulants, so they can lead to a wakefulness, so that if the patient take these medicines or these drugs at the time or near bedtime, they will result in insomnia. They will result in insomnia or interact with normal sleeping. So this it is better to be avoided during or near the bedtime. They should be used with caution according to the current BNF warnings in people with diabetes and people with heart disease or hypertension and those with hyperthyroidism due to their sympathomimetic effects, because their sympathomimetic effects may antagonize or may have a bad effect on diabetes and heart disease, hypertension and hyperthyroidism. The interaction between sympathomimetic and monoamine oxidase inhibitors is potentially extremely serious. This can result in hypertensive crisis that can be induced by that can be induced and several deaths have occurred in such cases. There is serious significant drug interaction between sympathomimetic drugs pseudoephedrine, ephedrine and vinyl propanolamine وغيرهم بالذات اللي بيتاخذوا اورالي مع المونو امين اوكسيديز انهبيترز. المونو امين اوكسيديز انهبيترز واللي هم انتي ديبريسنت اللي هم نون سيلكتيف such as الفينالازين وترانايل سوبرومين وسيلكتيف الفا 1 such as المينابرين. while السلكتيف ماو بي اللي هي بنستخدمها فقط في الباركنسونيزم زي السيليكلين. ما يهمنا بالذات اللي هي الدراج انتراكشن هي ريسبونسبل مع النون سلكتيف، بالذات النون سلكتيف ماو انهبيتر زي الفينالازين والترانايل سوبرومين. مع الاذر sympathomimetic drugs this can result in serious hypertensive crisis that can lead in some cases can lead to a death. فبالتالي هو fatal adverse drug reaction. This interaction can occur up to 2 weeks after the patient had stopped the monoamine oxidase inhibitors. So the pharmacist must establish any recent discontinued medication. انت ممكن عشان كده انت بالذات المفروض تساله اذا خاصه عرفت انه البيشنت هو اون انتي ديبريسنت اللي هو انتي ديبريسيف دراج او drugs that used for treatment of depression. اذا كان بياخد في ماو انهبيتر at least هو مفروض يكون وقف الماو انهبيترز ديل قبل اسبوعين من انه ياخد اللي هو النيو decongestant drug. now إن شاء الله قلنا هو should the patient should according to the BNF warnings قلنا هما أو sorry في المونو بالنسبة regarding المونوامين oxidase inhibitors as I mentioned هي أنت as a pharmacist you should ensure that إنه هو المريض at least وقف الاستخدام بتاع المونوامين oxidase inhibitors at least 2 weeks before you giving him a decongestant drug. A study conducted in the USA showed an association between the use of phenyl propanolamine and hemorrhagic stroke واللي هي أنا تكلمت عنها قلت لكم ده السبب اللي خلانا إن نعمل withdrawal للنوفلو الإيجيبشن برودكت لأنها فيها phenyl propanolamine. Now with this common preparation beside the decongestant we have antihistamines. You will find the use of antihistamines in اللي هو الكف in common cold preparation. These preparations either tablet or syrups. Antihistamine can reduce some of the symptoms of the cold such as runny nose, rhinorrhea and sneezing. These effects are due to the anticholinergic action of antihistamine. لأنه الأنتيهستامين معظم الأنتيهستامين عندها antimuscarinic effects and antimuscarinic effects can lead to dryness of these secretions, stopping of this secretion. فهي فعالة في إنها تقلل الراني نوز أو تقلل reduce الرينوريا. Antihistamines are not so effective at reducing nasal congestion. Although some such as diphenhydramine may also be included in the cold remedies for their supposed antitussive action or to help the patient to sleep. النيزل كونجيشن اللي ممكن تعمل له ريليف للنيزل كونجيشن هي فقط السيمباسوميميتيك as we see in the previous slides. الدايفينهيدرامين وانتيهستامين فبنلقاه بيستخدم بصورة كبيرة في ال cold preparations أو ال cold remedies due to ده لأنه هو عنده supposed antitussive effect، عنده antitussive effect يساعد في بالتالي الريليف بتاع اللي هو الدراي كف. also can help the patient to sleep. انتوا عارفين ان الهستامين بنستخدمها as sleeping aid او can aid the sleep due to the effect on the CNS they can produce drowsiness. فدراوزنس ده بيساعد في السليب. The problem of using antihistamines, particularly the older types, chlorpheniramine, اللي هو first generation antihistamine, is that they can cause drowsiness. وبالتالي هي الفيرست جنريشن بنقول عليها sedating antihistamine، والسكند جنريشن هي non-sedating antihistamine لأنها cannot cross the blood-brain barrier وبالتالي cannot produce the drowsiness as a central side effect. Alcohol will increase this effect اللي هو الإفكت بتاع drowsiness، الإفكت بتاع sedation as will drugs such as البنزودازبين والفينوسيازينز والباربيتوريتس. all of these CNS drugs can produce اللي هو marked sedation. بالتالي they can have the ability to cause drowsiness due to their CNS depressing effect. فالاستخدام بتاعها مع concomitant use with antihistamine مع الكحول or these other CNS drugs benzodiazepine, phenothiazines or barbiturates can potentiate the sedating effects of the antihistamine, and this can potentiate the drowsiness, and this is so that you should cautiously consider this if the patient have one of these as a prescribed drug, because all of these are prescription drugs اللي هي بنزودازيبين or الفينوسيازين or الباربيتوريتس. اذا البيشن بياخدها معناه انت هتحط في بالك انه لما تديه انتي هيستامين the antihistamine can potentiate the drowsiness and the sedation that produced by these drugs. Antihistamine should be avoided in patients with prostatic hypertrophy and closed angle glaucoma because of the possible anticholinergic side effects, and we mentioned this or discussed this in the first lecture. because الانتيهستامينز عندها anticholinergic side effects. anticholinergic effects لأنها هي بتكفي برضه المسكرينيك ريسبتور، بالتالي عندها انتي مسكرينيك anticholinergic adverse effects اللي هي من ضمنها انها تعمل لي urinary retention. بالتالي كان potentiate the urinary retention that occurred in male elderly patient نتيجة للbenign prostatic hypertrophy. وبرضها ممكن لأن انت انتي مسكرينيك افكتس معناها عندها اتروبين لايك افكتس في الاي، ممكن تعمل لها انكريز في الانترا اوكيولار بريشر نتيجه لانها هي هتقلل لي الدرينج بتاع الاكيوس هيومر، زائد انها هي هتعمل لي دايليتيشن في اللي هو في الايرس بيوبيلاي ماسل وسيلياري ماسل، وينتج منها اللي هو ديكريز في الدرينج بتاع الاكيوس هيومر. بالتالي كان الرايز الانترا اوكيولار بريشر، وبالتالي هي كونتر انديكيتد في البيشن اللي عندهم جلوكوما. في المانجمنت بتاع الكولد والفلو بنلقى سبليمنتس مشهوره جدا اللي هي الفيتامين سي انا الزنك، نعتبرها سبليمنت. A systematic review found that higher dose of vitamin C over 1 gram per day reduced the duration of colds about half a day، اللي هو a reduction of approximately 15% of the duration. بالرغم انها هي ما كبيره ما فعال، لكن هي تقريبا يعني اذا كان الديوريشن بتاع حتقلل بنص يوم، حتقلل الديوريشن بتاع السيمتوم بنص يوم. هل هي فعالة ما فعالة؟ المهم هي في النهاية الرول بتاع فيتامين سي، بالرغم انه في كلام بيقول انه هو ما عنده اني انتي انفكتيف او انتي فايرال افكت، لكن حسب الدراسات انه هو فيتامين سي كان ريديوس السيمتومز باي هالف ا داي، نص يوم. اذا كان التوتال ديوريشن بتاع about 10 ايام معناها حتقلل بنص يوم. الزنك برضه هو supplement. We have two systematic reviews have found limited evidence that zinc gluconate or acetate, zinc acetate موجود في الشكل بتاع لوزنجز may reduce continuing symptoms at 7 day compared with placebo. في دراسات عندنا دراستين محكمات منهجيات اللي هم بيقول انه هو ممكن الزنك يقلل لي السيمتومز يخليها ل7 ايام فقط، وده مقارنة بالبلاسيبو. دي سبلمنت اللي هي بتاعت الفيتامين سي والزنك. فيتامين سي قد يكون موجود alone or in combination with zinc، or الزنك احيانا هو alone في الشكل بتاع لوزنجز. الأذر اللي هو drug therapy that can used to manage the common colds and flu. we have الكف remedies، لأن الكف اللي هو واحدة من السيمتومز that occur commonly with the cold and the flu. لكن إن شاء الله we will talk about it in a separate lecture about the cough remedies, the drugs that used to manage the cough or to treat the cough, either for dry cough, antitussive drugs, oral expectorant, oral mucolytics. We will talk about inshallah in a separate lecture. The analgesics, and analgesic we'll discuss in a separate lecture also, and the products for sore throat. Inshallah in a part of another lecture we'll talk about the drugs that or products that are effective for treatment or management of the sore throat and symptoms that commonly occur with the common cold and flu. Which is a better as a dosage form? Is it the nasal spray or the nasal drops? We will see that the nasal sprays are preferable for adults and children over 6 years of age because the small droplets in the spray mist reach a large surface area. Drops are more easily swallowed, which increases the possibility of the systemic effects. إذن في children over 6 years of age and adults the preferred one is اللي هي nasal spray، لأن nasal spray will cover large surface area، وبالتالي can have اللي هو topical effect في regarding النازل cavities. و الدروس not preferred في الادلت لانها نتيجه can be swallowed، لانها هي نتيجه للارج اوبننج بتاع النازل كافيتي، هي can be اللي هو swallowed، فبالتالي once انها swallowed معناها حتكون عندها بعد ذاك systemic effects. Regarding a children less than 6 years of age, drops are preferred because in young children the nostrils اللي هي external openings of the nasal cavity اللي هي nostrils are not sufficiently wide to allow the effective use of sprays. من كده بنلقى manufacturers of pediatric drops advise consultation with the doctor for children less than 2 years. ده regarding الدروبس. children أقل من 2 years هم المفروض تكون فيها consultation أو referral to أو not used except after the consultation of the pediatric physicians. Prevention of flu. البريفنشن اوف فلو هي the regular hand washing، والآن العالم كله شغال في الهاند washing. This is a prevention can prevent all of the viral transmission of the viral infections, so that in both cold and flu it is an important issue اللي هو regular hand washing to provide prevention against this viral infection. Regular exercise also, because the regular exercise can improve the immune and the action of the immune system. فهو is can have a role in prevention of the colds. Flu, because it's caused by different viruses, and this virus responsible for more serious symptoms, so that the vaccination is very important to prevent for prevention of flu. احيانا بعض الفلو ممكن تكون محتاجه لتريتمنت مع with antiviral drugs according to the severity بتاعت symptoms in each patient. In the UK, the health service now provides vaccination to a risk groups. ما كل الناس محتاجين ل vaccination. في risk groups according to UK health service هي محتاجة ل vaccination اللي هم we have all patients over 65 years old, geriatric patients, they need a vaccination. Those who have chronic respiratory disease including asthma, chronic heart disease, chronic renal failure, diabetes mellitus, all of these patients also need vaccination. And the third group is that those who with those who are immunosuppressive due to a disease or treatment. Immunosuppressive can be immunosuppressive patient can be due to disease such as they acquired an HIV اللي هو infection. HIV will cause immunosuppression. And those with on treatment with immunosuppressive drugs such as glucocorticoids, tacrolimus, other immunosuppressive drugs, الانتي-كانسر. كثير من الانتي-كانسر هي immunosuppressive، فهم ديل محتاجين بنعتبرهم as risk group. Pharmacists should encourage and remind those at risk groups to have an annual flu vaccination. دي واحدة من الرول بتاعتك كفارماسيست. إذا بيجيك عندك regular customer أو regular patients that come to you in the community pharmacies that they are over 60 years old or they suffer from a chronic disease or they are that they are immunosuppressive, you should remind them تذكرهم إنهم ياخدوا annual vaccination annual flu vaccination. And that is all about these symptoms اللي هم common cold and flu. Now we will discuss the case. We have a case study. We have Mrs. Allen. He a regular customer to your pharmacy in her late 60s. Ask what you can recommend for her husband. هي جاية ما لنفسها، جاية تسأل من recommendation for her husband. He has a very bad cold. The worst symptoms are his blocked nose and sore throat. هي قالت لك إنه هو the worst symptoms هو suffer from اللي هم ال blocked nose and sore throat. Although his throat feels sore, she tells you there is only a slight reddening she looked at this morning. يعني في كأنها هي beginning بتاع sore throat في inflammation اللي هو slight reddening ده beginning بتاع sore throat or inflammation. He has had the symptoms since last night and is not feverish. والsymptom دي بدأت start last night. هو free of fever، ما عنده fever. He doesn't have headache. طبعا دي كلها بعد ما انت بتسألها هي بتجاوب لك على الحاجات دي، ده ملخص للإجابات بتاعتها. He doesn't have headache but he complained of headache. When you ask her if he is taking any medicine, she says yes, quite a few for his heart. She cannot remember what they are called. لكن انت when you check the past medical record بتاعته you find that he is taking aspirin 75 milligram daily, ramipril 5 milligram daily, bisoprolol 10 milligram daily, and simvastatin 40 milligram daily. This is the case. The questions: the first, are the symptoms indicate cold or flu؟ واضح جدا انه السيمتومز دي هي indicate cold rather than flu. الدليل اللي هم اول حاجه blood nose the common mainly with the flu and with the cold. a sore throat هو برضو كمان free of fever not feverish. فدي هي symptoms واضح انها هي symptoms بتاعت cold rather than flu. Second question: is Mr. Allen a candidate for repair؟ هل انت بترشحه لانك تعمل له repair for the physician؟ The answer is that Mr. Allen is not a candidate for repair because he suffered from minor cold symptoms, so that no need for repair. Third question: is oral sympathomimetics a good choice for Mr. Allen and why? The oral sympathomimetic are not a good choice for Mr. Allen because he suffered from a cardiac disease. He is taking ramipril, ACE inhibitors, aspirin and platelet in a low dose, and bisoprolol, beta blocker, so that the use of sympathomimetic drugs will antagonize the effects of, for example, bisoprolol, or we can stimulate the sympathetic response, which is not desired in this patient, so that the sympathomimetic drugs اللي هو decongestant هنا are not a good choice for Mr. Allen and should not be given for this patient. Why? I mentioned already, because they can, for example, they can worsen his hypertension so that not be controlled by the drugs he already taken. What treatment you recommend? The answer: you should recommend simple analgesic. You should recommend simple analgesics such as ibuprofen or paracetamol. Mrs. Allen asked if it is worth her husband taking extra vitamin C, as she heard this is good for colds. What is your answer? You should be honest that you can tell her that vitamin C can reduce the total duration of the symptoms by half a day according to the studies, and بعد ذاك تديها decision is it هي إذا هتاخده أو ما هتاخده، خلي الديسيجن عندها. But vitamin C هو كان according to studies that he can decrease severity of the أو can decrease the total duration of the symptoms of the common cold. ده حسب هي إذا if costly I think she will not take it, but if it's cheap she will take it. Thank you for the listening, and that is all about this lecture.